All right, welcome back to ABA exam review and the continuation of our BCBA practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Benny eats his first meal of the day at 7 a.m. sharp. 2 hours later, he eats a snack. Then 3 hours later, he eats a second meal. He repeats this pattern until he has eaten 4 full meals in the day. What type of measurement is described in relation to when Benny eats his meals? So we have a pretty basic measurement question. It's just presented and asked in a different way. First things first, we need to identify what behavior are we looking at. Well, we're looking at Benny eating his meals. Now, what do we know about Benny eating his meals? We know his first meal comes at 7 a.m. 2 hours later, he eats a snack. 3 hours later, he eats a second meal. And then he repeats that pattern until he has eaten 4 full meals in the day. So what are we measuring here? Well, we're measuring when Benny is eating his meals. We first know that he eats at 7 a.m. sharp. There's then a 2-hour break for snack, a 3-hour break, and then he eats his second meal. So we've got 5 hours in between those meals. So if we're measuring time in between the meals, then what type of measurement are we describing? A, repeatability. Repeatability has to do with the count. So frequency, how many? We're talking about when Benny eats his meals. So when does Benny eat his meals? He eats them at 7 a.m. sharp. He then waits a few hours and eats the next meal. So we're not counting his meals. We want to know when he eats his meals. So what we're measuring here is really interresponse time, time in between his responses or his meals. When we think about B, temporal locus, that's what we're focused on. Temporal locus includes our interresponse time and our latency. When we think about temporal extent, we're talking about duration. We're not talking about how long his meals last. We're talking about how long he goes in between eating his meals. And then D, time sampling. Time sampling is a discontinuous measurement procedure. We're not using any sort of whole interval, partial interval, momentary time sampling, interval system, or time sampling system here. So D is out. What we're looking at is time in between Benny eating his meals. We know he has this pattern he goes through until he eats 4 full meals in a day. So he'll eat, he'll take a break, he'll eat again. We're measuring how long that break is, time in between, which is temporal locus. A behavior analyst is using a changing criterion designed to help a client increase their daily exercise duration. The initial goal is 5 minutes per day, which will be gradually increased by 2 minutes each week until the client reaches 30 minutes per day. The analyst wants to improve their trust that experimental control has been demonstrated. What should they do? So experimental design question, single case design question, and we want to know about experimental control. Experimental control just says our manipulations are affecting the behavior. We have control over the behavior. Now, of course, our reversal designs, our classic reversal designs, are really good at demonstrating experimental control because we're actually removing the intervention altogether or the manipulation altogether and seeing what happens. But in this case, we're using a changing criterion design. So with all your different designs, we need to know, how do we figure out experimental control? Well, there's different ways to do it with changing criterion designs. So let's look at A. Should he increase 30 minutes per day to 1 hour per day? In other words, should he increase the goal? Well, just because he increases the goal doesn't prove experimental control, because the behavior can be changing and getting to that goal, even if we're not controlling it. So A is not really going to help us learn about experimental control. B, decrease the number of criterion changes. If you have a changing criterion design, the more changes you go through, the better, the more experimental control you are likely demonstrating. C, revert to previous criterion changes occasionally. Yes, what we might want to see is a criterion change that moves like this, and then the behavior follows, and then we revert back. What we want to see is that behavior following the reversion. If we can do that, then we can start to trust that we have experimental control. And then D, make smaller criterion changes. Ideally, you want to differ your criterion changes or make different sized criterion changes. So if you can kind of put a range of criterion changes, sometimes a large change, sometimes a small change, because all you really want to see is that the behavior is following your change. So the bigger range of changes you make, if the behavior is following those changes, that's really strong. However, just smaller criterion changes isn't going to be better than C, which is reverting to the previous criterion changes occasionally. A skill acquisition plan has been going on now for 2 weeks now with little to no progress. After a supervision session, you, behavior analyst, want your technician to make sure that the client no longer makes errors for that particular skill. You believe the errors are now part of the behavior chain. What type of prompting strategy would best help achieve this request? So we've got a prompting question, prompting strategy question, and you need to pick the strategy that's going to best achieve what you want to achieve. And what do you want to achieve? Well, you want your technician to make sure the client is no longer making errors. In other words, you're using errorless learning. Now, when we use errorless learning or errorless teaching, we're preventing all errors from happening because errors lead to more errors. And a lot of times they do become part of the behavior chain and we have to unteach them. Now, if we're going to use errorless teaching, we're going to do everything in our power to prevent errors from happening. So what type of prompting strategy is going to get us there? A most to least prompting strategy. Yes, with most to least, the highest level is errorless teaching. That's the most prompting you can give, where you're preventing all errors altogether, including physical prompting. What about B, graduated guidance? Graduated guidance is a physical prompt, but you're only prompting as necessary and you're fading immediately. The graduated guidance is not quite as strong as errorless learning. C, least to most. This is the opposite of errorless, where you're letting the person make errors. You're only using non-intrusive prompts, and the lowest level of least to most, or the highest level, depending on how you look at it, is letting the client respond without help. We've already done that. So least to most is not going to help us achieve what we want to achieve. And then D, verbal prompting only. Verbal prompting could be effective, but it's not true errorless teaching. If we want to use errorless teaching, if we want to prevent all errors, we need to use some sort of most to least prompting strategy. Jessica, a behavior technician, has been using hand-over-hand assistance to help her client Sam complete a puzzle. However, she notices that Sam now waits for her to initiate the hand-over-hand assistance before attempting to place any puzzle pieces himself. What describes Sam's behavior based only on this information? Key here is based only on this information. So what do we know about Sam and Jessica? We know Jessica's using hand-over-hand assistance to help her client, so some sort of physical prompting. Sam now waits for the hand-over-hand assistance or the prompt before attempting to place any puzzle pieces himself. So just reading that, and remember, because we always attack the question and try to predict our answer, what does that look like to you? To me, it looks like prompt dependency. Jessica's been using this physical prompting. Sam now waits for the physical prompts before making any attempts. And that's the information we know. So how are we going to describe Sam's behavior? A, Sam is engaging in task avoidance. What doesn't appear Sam's avoiding the task. He's just waiting for the hand-over-hand assistance to start the task. So based on our information, A is not right. B, Sam is displaying prompt dependency. Yes, all the information points to prompt dependency. C, Sam is failing to display maintenance. Maintenance occurs when teaching stops. Jessica is very much still teaching Sam. This is not a maintenance issue. D, Sam is engaging in tangible seeking behavior. Well, Sam is not gaining any tangibles. He's not getting anything out of this. He's there doing a task, and he's not fighting the task or avoiding the task. He's just waiting for the prompt to begin the task. That's an issue. What best describes Sam's behavior based only on this information? B, Sam is displaying prompt dependency. You, a behavior analyst, are training a new behavior technician. The technician appears nervous and starts asking you several questions about events that might happen during session. Specifically, the technician asks you what they should do if the client or themselves are put in danger due to behavior during session. What should you instruct the technician to do if that were to occur? All right, we've got kind of a treatment planning question, ethical question. And in this case, we're talking about a crisis. And how do we know we're talking about a crisis? Because the technician says, what if the client or myself are in danger? And a crisis is when someone, including the client, including the tech, including anyone else, are in danger. So the tech is asking you, what happens? What do I do? I'm in danger, the client's in danger. How should I respond? What should you instruct the technician to do if that were to occur? A, the technician should put those behaviors on extinction immediately and contact you. Possibly, what do we have to have in our plan, right? If we know it's a possibility, even if we don't think it's a possibility, in every treatment plan, you have to write what? You've got to write a crisis intervention plan. Maybe extinction's in that plan, maybe it's not. So you shouldn't put a blanket statement like put the behaviors on extinction. It should be what's in the crisis intervention plan. B, the technician should find the client's parents immediately, keep the client safe, and then contact you. Well, what if the client's parents aren't there? What if they're somewhere else? What if they're in the clinic? There are a million reasons why B couldn't work. C, the technician should follow the crisis plan and then contact you. Whatever's written in that plan, which you wrote and you trained on, should be what they do. This is your job as an analyst. Prepare your staff for everything, including crises. And how do you do that? You write a plan and you train on that plan, and then you tell your technicians to implement that plan when that occurs. D, the technician should use their best judgment given the situation and then contact you. Never, right? D is not a very good answer at all. This is your case, right? You should be in charge. You should be calling the shots, especially if people are in danger. And what do you do in that case? Well, you should have a crisis plan already written and already trained upon, and you tell the technician, follow the plan, and then contact you. Thanks so much for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.